We have several interests in myeloma, but one, of course, important focus is how to treat the elderly. These are the majority of patients. But the elderly patients are much more heterogeneous than the younger patients, because when you are age 70, you can be very fit, you can be unfit, or you can be quite frail. So there is now there are algorithms available how to evaluate fitness and frailty in those patients. Generally, in a fit elderly patient, aged 65 to 75, we all recommend a 3-drug combination therapy, because the best possible outcome, namely the best possible depth of response, is the goal. We want to achieve complete remission. We want to achieve minimal residual disease negativity. So, and these patients usually tolerate this treatment quite well. If it comes to more elderly patients, then you have to, of course, balance the situation of the patient and the treatment you have available. You have to adapt the regimen and the dose of the regimen to the physical situation of your individual patient. So in frail patients, you will probably start with a 2-drug regimen, start with lower dose, and you will be very careful, because those patients have a higher risk for developing infections, particularly after the first cycle or during the first cycle. So you would think about preventive measures as well in order to reduce these risks. Biological age is, the way is what you orient yourself on. It's not the chronological age, as I alluded to. You may be 70 years old and you may be very fit, or you may be frail. You may be confined on a wheelchair and so have many comorbidities. So you have to individualize your treatment on the patient's condition, not only on the tumors, on the tumor, because you may have a very aggressive myeloma or a slowly evolving disease. But if you're an elderly and you have an aggressive disease, you still need a good 2-drug regimen, and you will adapt the dose. And if the patient is responding well, you may even, and tolerate the treatment well, you may even think about increasing the dose to the normal dose which we're using in younger patients. So it needs more fine-tuning and more taking all the different aspects of the individual patient into patient. Yeah, individualization of a patient. And of course the patients may have different expectations, and they may be close to your treatment unit, or they may be far away. So that also has an important role on what treatment you want to offer them, and what would be most suitable for them. I think there's a tremendous change now, because in the old days elderly patients were discriminated, and we are now focusing and realizing that this was completely wrong. So, and we now have better tools to how assess their biological fitness, and of course we are more open to listen to their needs and to adapt our treatment to their needs. May not be given the best drugs, may not be treated at all, may not be included in or involved in a thorough discussion of what their wishes are, what they want, whether they still want treatment, whether. So this depends very much on the individual patient's situation. If he is embedded in a big family and sees many, and his life is still fulfilling, those patients usually want to be treated and want to be relieved from their symptoms and from the burden of their disease. And that may be completely different in patients who are on their own, alone, without any social network. So you have to consider all these issues as well. something which is important for everybody who is diagnosed with a disease. He can choose. He can try to get as much information as possible and to become in charge, more or less, of the treatment and the management of his or her disease, or you can remain on the, let's say, more or less old classical habits where patients were living in a very hierarchical system, a social system, so they were not expected to get into close discussions with their physicians, so they were expected to just follow what has been advised or recommended to them. So this is a tremendous change, so people have to stand up, have to educate themselves, because then if they are more educated, they may realize that some of their concerns are not based on facts, and so they are better equipped to cope with difficult situations, with complications. So it's we are moving into a consumer-driven medicine, and people realize that they need to be active in order to get the utmost of the healthcare system. One of the reasons why there is a difference in outcome in patients of different, belonging to different social economic classes is probably not only the financial situation, the economic situation, but those people are probably not as well equipped for our society, being less actively, less, let's say, interested in or able to consider all the facts, to research, and to involve themselves, to be part of the decision-making process. And I think we should inform our society that they can change, they can improve the quality of the care they receive. So that is something which we should discuss in the future much more often. Yes, so how do you approach, this is also something which is important for patients. How do you prepare yourself for a consultation? First of all, you should think about what is important for you. What do you want to know? What do you want to learn from your physician? Which questions are important? And in order to facilitate the process, you should be prepared in different ways. You should have all the history of your disease available. You should have the important treatments you have received, a timetable of the investigations you had, so that will facilitate the process and will help the physician to get a clearer picture. But they should also be prepared and look at their symptoms and complaints and should communicate these complaints. And ideally, they should be they should not come alone. They should be followed by one of the close relatives or partners. So 4 eyes see more and 4 ears hear more, and they can take notes during the conversation. So there are different ways available to optimize the quality of the interaction, and so this is also a responsibility which is within the hands of the patient.